All right, let's continue then to talk about COVID-19. And the health department says that more young children are testing positive for COVID-19 and getting hospitalised. A team is currently investigating the infection spike in younger children, especially those under the age of 5. It was earlier reported that infections started with younger age groups and are now reaching older groups. There's also more hospital admissions, especially in the epicentre of Gauteng. Let's now bring in Dr. Lesley Bamford. She's a specialist in child, youth and school health and acting chief director at the Department of Health. Dr. Lesley, it's always a pleasure to see you. Thank you for availing yourself to SABC News once again.
Good afternoon, and good afternoon to the viewers.
So, Doctor, a lot of parents, I'm assuming, are particularly concerned about the reports that this particular variant isn't sparing children. I mean, what can you tell us about the rate of infections in children at this stage, and also, very importantly, whether these infections and hospitalizations are actually leading to deaths?
So I think, as has been reported, we are seeing a rapid rise in the number of cases, particularly in Gauteng, but also in other provinces. This started in Tshwane, but has spread to other parts of Gauteng, and as I say, also now more widely. So in Tshwane in particular, they have seen a fairly high number of children being admitted with COVID infection. Luckily, to date, those infections do not seem to have been severe. And as far as I know, there are no deaths have been reported yet.
Yeah.
So it is very early days, and we need to watch the situation very closely. But as I say, currently there is no indication that the virus, the disease caused by the new variant, is clinically more severe than that caused by previous variants.
Yeah. Dr. Bamford, many adults were or are in fact still hesitant to vaccinate, and it seems that it would be quite a tall order to ask them to vaccinate their children. So at this stage, what do we do? What can we do about the infection rates amongst children?
So there's no doubt that even with the new variant, the things that we can do to protect ourselves and our families remain the same. And those are to follow the simple non-pharmaceutical interventions, social distancing, being outside as much as possible, not attending social gatherings with many people, wearing masks and sanitizing, and then of course getting vaccinated.
Yeah.
We know that approximately 40% of adults have now been vaccinated. We have been seeing in recent days that the number of children 12 to 17-year-olds who are vaccinating has been increasing, and that is very encouraging. But as I say, the message remains the same. These are the things that we need to do to protect ourselves, our families and our communities from infection, and particularly from severe infection in the case of vaccination.
You know, we're hearing that this variant is more transmissible, and I wonder what exactly that means for us. I mean, you talk about non-pharmaceutical interventions, and I mean, at this stage, we're already washing our hands, sanitizing, wearing masks, social distancing as much as we can. I mean, what more can we do when when we're hearing that the variant is more transmissible? Is there anything else we can do?
So I don't think there's anything different. I think it is just about making sure that everyone consistently follows the practices that we've all come to know. Unfortunately, we have been seeing complacency.
Yeah.
We understand. I think we're all tired of some of these restrictions. But unfortunately, they are the things that we can do to prevent transmission of infection. And if we are dealing with a vaccine, with a variant that is more transmissible, then it is even more important than ever to follow these practices. And as I say, for everyone to be following the practices all of the time.
All right. Dr. Lesley Bamford, thanks so very much for giving us your time once again here on SABC News. Much appreciated.